So I'm going to show you kinesiotaping. That's kind of the stretchy tape. There's various different brands and forms for a pes Anserine. So if you have some inside what we call medial knee pain, even if it was like an MCL sprain, usually the pes Anserine is angry as well. It's 3 tendons that come here. It's your semitendinosus, your gracilis, one of your groin tendons, and your sartorius. What would be important if you had a provider kind of tell you more if it was more hamstring biased versus groin biased. So in this case with this knee, we're going more kind of groin and then kind of quad sartorius biased. So what you do is you take your piece of tape, run it about how long you want it to run, and then you're gonna give it a cut, and you could totally apply this on your own. The biggest thing though is that tape is usually kind of in our pain management category. And so definitely make sure to be aware of other stretches, strength exercises, kind of optimally loading it. And then we're gonna cut it into a Y. So what we're gonna do here is just cut down the middle. And I round the edges. That just makes it not peel on the corners quite as much. So you basically take that Y and you kind of cut it down and leave that bottom inch, overlap them, and then you're gonna round those corners. And then you're gonna apply it. So the pes Anserine runs on the inside of the knee. It attaches kind of right down here and then kind of runs up. So we're gonna follow those 2 ones kind of on the top. The alternative would be to run one down by the hamstring and the other either by the sartorius or the groin. You could also run 2 wider strips here, but I'm choosing to do the Y strip here. So you go down, apply. Prior to this, you would definitely wanna prep the skin by cleaning it with like some rubbing alcohol, kind of removing all the oils. Get that anchor down. That was no stretch. And then I'm gonna come up, I'm gonna fold those back. I'm gonna first run that gracilis. I have the knee bent so that kind of between bending and straightening, there's kind of the right amount of slack. I just did like 33% stretch on the tape there. And then coming up here. And then you can swim with this, sweat with it, shower with it, all of the above. Typically within 3 to 5 days, we would kind of take it off. If your skin's getting pink, hot, feels worse, obviously take it off. So there's our pes Anserine tape job. Goal would be that would help, but definitely don't forget appropriate stretching, strength, and appropriate loading. So have fun with that.